So we're looking at exercises to stabilize the knees, and these are stabilizing exercises which are going to be targeted after someone has maybe an ACL or an MCL sprain or tear. So looking at the muscles that cross the knee, the one we're going to focus on right now is the calf raises. As they cross the knee, strengthening the calves is going to help to stabilize the knee joint complex in its entirety. So the exercise is simple. We're just going to use simple body weight for it. What you want to do is you want to be able to stand with your legs shoulder width apart. Nice comfortable stance. And then all you're going to be doing is you're going to be raising your body up onto your toes and then back down. Just up onto your toes and back down. So it's a nice even contraction. Yep, for 2, down for 2, so it's nice and controlled. And at the top, you just want to add a little bit of a squeeze of that calf muscle as you get to the top end range. So looking at getting your client through the calf raises, again looking at stabilizing the knee complex. Standing shoulder width apart, nice comfortable stance, feet are pointing forward. So all we're going to get him to do is going to lift up onto his toes and then back down. So it's a nice even contraction all the way up to the top and then back down. So it's counting up for 2 and down for 2. With a little squeeze of that calf muscle when you get to the top. You're going to run through this. You're going to do 10 repetitions and using your body weight as a resistance. And 3 more. Good. How does that feel? Good. So again, this is looking at that stabilization and strengthening of the calf muscles. This is an exercise that you can do once a day, every other day. You're going to do 3 sets of 10 repetitions, and you take that 30-second break in between each set. So we're looking at another exercise which we can use to target the vastus medialis. So with this exercise, what we want to do is we want to have the client positioned and probably on their bed where they can get a towel rolled up and place it underneath the knee. What this is going to do is provide as a little bit of a bolster underneath the knee. And what we're going to do is the contraction is basically driving that knee down as we go into extension, but then also adding that little element of the external rotation of the hip, which is going to focus the contraction for that vastus medialis muscle. So you hold that contraction for count of 3, and then release. Let's count of 3, and then release. And that target is on that vastus medialis. And again, looking at that stabilization for your patellofemoral. So we're looking at, we got our client in position for the vastus medialis exercise. Sitting on the table or the bed at home, got the towel rolled up underneath the knee, which is the position that we want, the leg extended. You provide a little bit of a bend, which is going to provide that bolster and that buffer as we look to provide the contraction. So as she contracts, she's looking at providing that rotation as she contracts, which is going to focus on that vastus medialis. Contract, hold for 3 seconds, and then release. Contract, hold for 3 seconds, and then release. How does that feel? Good. So we got 4 more of those. So again, this is a good one to target the vastus medialis. It's a focus exercise, which is what we want. And 1 more. Okay, so again, to look at stabilizing the muscles around the knee, that medial aspect, which is going to help with that patellofemoral syndrome. This is an exercise you can do 3 sets, 10 repetitions with a 30-second break in between each set, and we can do that every other day. So we're setting up our client for the leg extension exercises. We have her high sitting on the edge of the table or the bed at home. Got the ankle weight strapped on, and the ankle weight can be various pounds, depending on the ability of the client. So it's in there, it's secure, and what you're going to do is you're going to just extend the knee, extend the leg up, contracting the quad. So it's a nice even contraction. It's up for 2 seconds and down 2 seconds. Up 2 seconds and down 2 seconds. You're going to do a set of 10. If you want to do 10 repetitions, 3 sets of those 10 repetitions with a 30-second break in between. How's that feel? Good. Let's do 3 more. Good. We're getting a good contraction of the quad at the top. Last one. Good. So now as we're looking at that variation, where we're looking at that focus on that vastus medialis, what we want to do is we want to add that rotation of the hip, which is going to focus on that medial part of the leg, which is the vastus medialis. So as it comes up, you're going to turn and get that focus on that vastus medialis. And even if as you palpate on yourself or you palpate on the client, you can feel that medial part engaging as they come to the end range. Which is perfect. How's that feel? Good. And again, that's going to help with the stability of the knee, stability of the ankle, or stability of the knee with the patella femoral. And this is an exercise you can do 3 sets, 10 repetitions. You can do that once a day, and you can do that every other day.